So the thing comes in everybody's mind that whether they should go with IVF in a standalone clinic or in a multi-specialty center. So let us enumerate few points to tell that a multi-specialty center is far more better than getting an IVF done in a standalone center. Why then the multi-specialty hospital is good? First and foremost, there are many couples who have got many congenital disorders, the female is suffering from it, or medical disorders like diabetes, hypertension due to age or due to their lifestyle. And congenital disorders maybe a patient is having seizure disorder since childhood, or she's a congenital diabetic patient. In these patients, she is already on a lot of medication since childhood. So before getting the oocyte retrieval done, there is a pre-anesthetic checkup. The anesthetist sees the patient, and the anesthetist would obviously definitely want a clearance from other specialties. So other specialty clearance means obviously either you have to go outside the hospital or in the hospital. So if it is a standalone center, then we have to go to the outside the hospital. But in a multi-specialty organization, in the hospital only everything is taken care of. Secondly, if God forbids, but if you have a complication during your oocyte retrieval, and might be that you need ICU support. In that case, if you are getting it done in a standalone center, then obviously you have to be transported in an ambulance to other hospital, and it will take a lot of time during transportation. But in a multi-specialty hospital, that is not the case. Everything is covered in the ICU and in the same organization, and there is no time lag. So obviously the precious time that is needed to take care of you, that is in our hands. Thirdly, if you have a complication during that, like a pregnancy, and not a pregnancy, like after the pickup you have a complication maybe of ovarian hyperstimulation syndrome or anything, then also a standalone clinic, it closes down. It is open only from 9 to 5. So when it closes down, then you have a question where to go. But in a multi-specialty hospital, that is not the case, because the emergency is always open. It is open 24/7. So obviously you can go anytime and you can see the doctor, and everything will be taken care of. So these are some of the benefits of a multi-specialty organization vis-a-vis a standalone hospital. Thirdly, if the pregnancy is being carried and it is being treated care of in that organization only, so you are very much comfortable with the gynae team, the NICU team, because you have been visiting that hospital many times. Fourthly, in any multi-specialty hospital, any corporate hospital, what happens, a UHID is created for you. So that UHID, whenever you go to other specialty, that will disclose what all treatments you have taken, which all doctors you have seen, so that if anything you forget, that is not missed by the doctors who are treating you. So that is a big boon for the patient. So obviously a multi-specialty hospital is far more better than seeing in a standalone center.